The COVID-19 epidemic is a major public health emergency that has spread around the world. So what exactly is the virus and how similar is it to the rest of the coronavirus family? For those questions earlier, I interviewed Dr. Gao Fu, the director of the Chinese Center for Disease Control and Prevention. Let's listen in. How much more do we know about it since January?
What I can see from this is the 7th coronavirus infecting human beings. 7th. We already have 6 we know is infected human beings, but none of them really behave like this. This is really a special one. For example, from first incubation period can be as long as 14 days, even longer. And the second, for the virus city, and you might have the virus really, can last for more than some reports say could be a month or something.
Yeah.
That's like a chronic, like a chronic disease, a chronic virus.
Yeah.
And also, the virus can survive in some surface, some area for a long time. For example, in a sewage. You never think this kind of, because it's an old-developed virus. It's not a non-old virus. You can also detect the virus from your digestive system. That means 1/3 of the patients, they have the virus in their stool.
Right.
So that's, really the behavior of this virus. That's like it's a coronavirus. So we never think, it can go like this.
Right.
So this is why, to be honest, we know less than what we should know. And we know less what we know. So we really need to know more about what we don't know.
The sequencing suggesting about 80%, if I remember right, compared to what we knew earlier about SARS, for example, from bats. Now, do we have further studies of that? Do we have any latest information regarding it?
When you are talking about 80%, that's the average. So this is a coronavirus. Coronavirus is a single-stranded RNA virus. When you say single-stranded, that means the whole genome starts 0 to 30,000. It's a linear, you call it linear sequence there. But those linear fragments, different kind of functional fragments, can be derived from different viruses. We call it recombination.
I see.
So for this virus, you can see some area, some fragments, they can 98% identical to SARS, but some fragments, some area, like receptor binding site, receptor binding fragments, we call the S, it's only less than 70% with SARS. So average, 80%. So this kind of virus is known for its recombination, i.e., you got one fragment from one precursor, the other fragments from the other species.
That's right.
So it's very hard, very difficult, sometimes for you. This is why we are talking about get the whole genome sequencing to compare where the virus from. When you are talking about the origin, a good example is MERS. So we know MERS, from the cumulative science, we know the virus is from bat, that's for sure. But the problem or the question now is whether or not there's another mammals, another animals between bats to human. So maybe it's bats direct jump to human, but most likely there's an intermediate host.
But it's like lottery, isn't it, in a way, Dr. Gao, because you really have to try everything in order to know it. But apparently at that time when doing research, you tried the one-hump camel and it worked. It told. So what would that mean for all of us now? It would took forever to eventually find out what is the immediate host if there were one.
We are, I say, the scientist community. We are working very hard. I don't know whether or not we can have a quick answer soon. Maybe it takes time. And in the history, so many pathogens, so many viruses, we never got the origin of that virus. So many examples. Once you have this virus jumped, maybe this virus, now we think it's jumped, maybe, just recently. It could be a long time ago. They already have sporadic occasionally they infect human beings. Just suddenly they obtain the ability to infect the population.
So there could be a lot of possibilities,
yes,
actually.
That's right.
Since the start of the COVID-19 outbreak, the country has sent various expert teams to Hubei province. With the joint efforts of the whole nation, the positive trend in preventing and controlling the epidemic in China has been constantly consolidated and expanded, and the restoration of normal production and everyday life has been quickened. And Dr. Gao Fu, in the interview earlier, responded on the human-to-human transmission, which is a key issue in the prevention and control of the epidemic in China. Dr. Gao, another thing. When did you travel to the city of Wuhan?
On the 17th, the commission decided to have a senior advisory group to go there again. I'm one of them. We have 6 members, including Dr. Zheng Nanshan, Yuan Guoyong, Li Lanjue, Zheng Guang, Du Bing. So we went there, and I think we got together in the evening of 18th. So we went to the hospitals and we talked to the doctors and all this. On the 19th. On the 19th morning. Yeah. And in the afternoon we have a group meeting. Of course, we already got the conclusion. It's clear.
So you were not, if I just clarify here, Dr. Gao, you were not involved in the earlier 2 batches of scientists and virologists being sent to Wuhan by the National Health Commission?
No.
You were not there?
I'm not in that.
Part of that.
Yeah.
So, Dr. Gao, can anybody in the world today be able to tell when it began human-to-human transmission?
We published a paper in New England Journal of Medicine the end of January. By then, and also my colleague, Dr. Wang Chen and Cao Mi, they published a paper in Lancet, also at the end of January. So from then, retrospectively, we try to dig out all this data. So we realized maybe the human-to-human transmission occurred late December.
When were they infected? Probably it has to be also traced back even weeks before they were discovered, right?
Yes, that's right. Yeah.
Because of the incubation period.
Yeah.
All right.
Now back to the the wholesale market. In that market, from the very beginning, all the clusters and all the let's say all is not a good word. Now, if we go back, from the very beginning, we thought it's all, but now it's most.
Right.
Okay, most of the cases, they are from that market. That definitely directs you to investigate in that particular market. You realize all these patients, they have some connections. Of course, even from the very beginning, you have 1 or 2, some cases, they have no, I call it no evidence to have a direct connection with that market. Pay attention to the word I'm using, evidence. So you look at, I remember one of the patients from the 27, no close, but when you talk to the patient, when you do this investigation, it looks like there might be some clue. He or she might have some connections.
Right.
So we don't have the evidence, but we already suspected there might be human-to-human transmission or person-to-person transmission. And more importantly, based on the knowledge, based on the understanding of other coronavirus we know, there must be a human-to-human transmission. The only thing is whether or not it's very serious, whether or not, it's so popular. Or if there's human-to-human transmission, is it limited human-to-human transmission? Or is it really very efficient? Or is just, as a general, rate of the transmission?
Talking about that, I still want to come back to the human-to-human transmission, because there were enormous amount of reporting and also social media tweeting going on, a mixture of facts, imagination, misinformation, all at the same time. So it's very hard for people now, even as a professional like me, to figure out exactly what was the information being given at the time and what exactly was the nature of that communication taking place in China and elsewhere. So, Dr. Gao, please help me with it. Have you ever said in public that it is not human-to-human transmission?
That's a very good question. I never said anything about there's no human-to-human transmission in the public.
So I want to put this on record. You have never said that before in public.
No, I never said no human-to-human transmission in the public. Never, ever.
Dr. Gao Fu is a world-renowned virologist. His research focuses on the cross-species transmission, or host jump. This is when a virus jumps from one species to another, particularly from animal to human. During the 2014 Ebola outbreak, he led the China Mobile Test Laboratory in Sierra Leone, playing a key role in fighting against the epidemic. As the expert in the field, though faced with some controversies, he still defended the credibility of every word he said. So how does he instill a sense of collective responsibility during the onset of an outbreak? Dr. Gao explains this to me.
Even for a public health worker like me, or also a virologist, and of course, again, science-based. When you are talking about science-based, first, knowledge is a part of a science. That's what you know before. And also, that's a perspective part. That's a retrospective part. Perspective part. Based on whatever you know, how would you see in the future for that part? So that's the science. So science gives you a chance to predict something. So when you make any public comment, you based on the past knowledge, you based on the perspective of the future. So this is how you make any comment as a scientist. Even from the very beginning, I don't think it's good or it can put any scientist in a position to say there's no human-to-human transmission, because this virus is unknown, but also this is a virus from its family. It's always human-to-human transmission. So the only way you are looking for evidence. You are detective. So like you are a detective trying to figure out the suspect. And then maybe finally you are looking for that particular criminals. But from the very beginning you have so many suspects. Like you are a detective. The job for us as a public health worker, we are detectives. The only thing is, for a detective, they are looking for someone in the same species. For the virologists, for the public health workers, like in this case, we are not the same species. Right. We are human beings, they are virus.
So you're trying to say, Dr. Gao, that without evidence, you would not rule out and you would not say for definite either whether it is human-to-human transmission.
No.
And therefore, the public, when you said that, whatever statement you made over the past few months, could come to their conclusion up to interpretation. Is that what you're trying to say?
Yeah, about the mask wearing. We know mask wearing is very important, the important part of the strategy or measures. But again, still in some countries, including some countries in North America, some countries in Europe, they are still waiting for the evidence, scientific evidence to support
yes.
Their claim to encourage the public to wear the mask. Right. That's all, it's so clear. And even though in China, that's already a routine practice, still people need for the evidence. I can't give you, if you put it on the other way, don't say, this is a human-to-human transmission, or this is a pandemic. If we put this event back, if only there is only very, very limited human-to-human transmission, but you exaggerated too much, you put too much effort or work. For example, early January, you already introduced lockdown or containment measures. Can you imagine what would happen? So this is why the dilemma for a policy making for the public health issue. I mean, you can see this from why we sacrificed so many lives in Europe, even more than in China. You would think, well, because we already know China has taken this lockdown or containment method, we know this is very serious. Yet, in some areas, they are still experienced by the end such a disastrous, process. It's a pity, but well, so that's the whole process. For the scientists, especially I want to mention for the public. Again, public involvement, public understanding is the basis for the policy making.
Right.
So otherwise, you always this dilemma.
You mentioned a very important phrase, which is evidence. But in an ongoing process of discovery, evidence could come early, it could also come late. Then how decisions should be made in terms of evidence or not yet having evidence? So what are the priorities from a virologist perspective? Some you might suspect, but you don't have evidence. Yet the suspicion was based on retrospect,
yes,
understanding. Some you have evidence, and therefore you should focus on it, and yet you don't want to exaggerate it or talk about it out of proportion. So this is a very interesting and delicate fine balance we're talking about, Dr. Gao.
You are using a very good word I usually use, balance. Balance is everywhere, especially when you're talking about evidence-based. So now we are living in a world, it's always evidence-based science, evidence-based medicine. This is why you have evidence-based medicine. So evidence are the key for you to make any decision. I think this kind of is a war. In China, we usually see this kind of war as the people's war. So when you are talking about the people's war, means you got to get everybody to be involved. So I call this kind of war is all the people, for the people, by the people. So this is the war. Who is doing this war? Us. So this is our own war against the virus. So this is why it's a war of us. And this is the war by the people. You got to have everybody to be activated, everybody to be involved. For example, the isolation, quarantine. If no one follows your rule for this quarantine and isolation, you are not in the business. And we say for the people. So you are working so hard. For whom? For everybody. So this is why I call this kind of war. It's all the people, for the people, by the people. And social distancing is the key. But if people didn't realize they need this social distancing strategy, so they will still walk around, they still visit the park, they still go for bars, and then how can you win this war?
Right.